Thank you all for being here. I'm Colonel John Pagoric. On behalf of our TAG, General Michaelitis, I want to welcome you here to Pease. Just a few administrative items to cover first. If we have to leave the building, there is an exit on this side. You can see they're marked here in the back. There's also bathrooms afterwards if you want to go to them. You can work your way out, and it's behind me as well. I want to recognize a few of our congressional delegation representatives that are here. Peter Clark representing Senator Shaheen. Kerry Holmes representing Maggie Hassan, and Patrick Carr representing Congressman Christopher Pappas here as well. And did I miss anybody?
Yes. Charlotte from my customer's office.
Okay, wonderful. Thanks so much for being here. We appreciate that. Really the goal, let me start off with, this is a big deal, what we're going to talk to you about today. You know, I asked one of our guests, Colonel Goodman, who will be speaking here shortly, what are the chances that we have a study, which is what we're going to present to you here today. And I think it's a long shot. I think the timing was right. I think the media coverage that we had, the activism that we have, a bunch of our retirees and yourselves, the connections and the timing all worked out. So this has happened a lot quicker than it could have. So I feel very grateful for that. So the purpose of today's meeting is to inform you about this proposed health study and for you to have a chance to meet with our experts that are here and have your questions answered. So a brief history on how we got here. Back in August of 2018, we had heard from retirees mostly about some concerns with their health, particularly cancer. In response to that, we assembled a working group, reached out to our state and federal agencies because we don't have a lot of the resources here, and the Air Force and National Guard to really bring focus to this. This working group had 4 goals that they set out to accomplish. And the first was to hear from all of you. And that's when we had that listening session back in the hangar when it was open, back in December of 2018. We also wanted to establish a registry to be able to communicate with you with updates. And we also had that December of 2018. And that was through the New Hampshire Office of Veteran Services. The third thing we set out to do was to create a resource or paperwork that you could bring to a doctor and start discussing some of their concerns and be able to maybe have early intervention. And we handed that out back in October of 19. And with the support of our congressional delegation, we requested the Air Force to conduct a study. And again, that's what we're going to be talking about today. So I feel very grateful for all the people that have got us here. So our agenda, I'll briefly touch on that. Colonel Brandisi will be speaking right after me. He's our public health officer. And there is a lot of health studies that are going on in our local area. So he's going to kind of give you a brief overview. We've covered this in the past, but they all use the name Pease Air Force Base. It seems like it can get very confusing. So when you see in the media and the different coverages, we want you to be able to differentiate between the two. So he's going to cover that. And this is an important one. The study that we're talking about today, it is going to be called the Pease Military Cancer Mortality Study. And I think there's a handout that many of you either will get or have. Is that handout gone out? And you'll see on the title of that is the study here. So when you're trying to get information about that, this will be important, the Pease Military Cancer Mortality Study. Following Colonel Brandisi, Colonel Goodman will speak. She's the commander of the United States School of Aerospace Medicine, also known as USAF-SAM. You'll hear that term used today. It's the 711th Human Performance Wing Air Force Research Laboratory out of Wright-Patterson, Ohio. And USAF-SAM is a premier institute for education and worldwide operational consultation, aerospace, and operational medicine. Following her, we'll hear from Major Weber, who's a doctor, who will discuss the study in more detail. He's a preventative medicine consultant, Epidemiology Consult Service Division, Public Health and Preventative Medicine Department at the same USAF-SAM out there at Wright-Pat. And at Wright-Pat, he manages preventative medicine research, surveillance activities, providing public health support to 125 installations. So what we'll do is, as each person speaks, if you could hold your question to the end of their time and then ask them. But we'll also, once we're complete, we'll open it up to questions as well. And I really need to emphasize, I want you to ask questions. We won't have our subject matter experts here again, maybe at the tail end of this, but this is your chance to kind of get things clear in your mind. And maybe it's something that we need to take into consideration that we haven't done yet. So it's really important that you do ask those questions. Like previous meetings, I ask you to help me keep the discussion open, respectful, and productive. As you can see, we will be recording the meeting today, and as we've done in the past, we'll post that out on YouTube. In the meantime, does anybody have any questions for myself? All right, if we're ready then, Colonel Brandisi, if you could start us off and cover those other studies that are going to go on. Then we'll go into the deep dive on our study.
So good afternoon, everyone. As Colonel Pogora pointed out, my name is Derek Brunizzi. I'm the Installations Public Health Officer. And so some of the studies I'm going to talk about briefly in the next few minutes are being led by ATSDR. And for those of you that have attended previous meetings in this room and in the hangar, we've had representatives from ATSDR here. So they are not here today, unfortunately. So I'll do my best to answer any questions. But again, if there are any questions I can't answer, I'll be happy to take those questions back and then get you the appropriate response. So I'm going to cover three major studies, and I would just want to make sure I cover the notes here so I'm accurate in these studies. So there's the exposure assessment, there is the multi-site health study, and then the Pease health study. Those are kind of the three big ones that you probably have heard of both locally and nationally. The exposure assessment is, again, led by ATSDI and is conducting exposure assessments in 8 communities throughout the nation. I believe one of those is in Massachusetts near Barnes Air National Guard Base. And it's to cover current or former military installations that are known to have had PFAS in their drinking water. This project will include blood and urine testing, as well as some water and dust sampling in an effort to increase knowledge around human PFAS exposure. Now, it's important. We're trying to understand the health effects of PFAS exposures to humans. So to be clear, this one here is not a health study, and Pease is not a part of this exposure assessment location. The multi-health study is similar to the Pease health study, and I'm going to talk about that one just in a minute. So again, led by ATSDR, they plan to conduct a multi-site cross-sectional health study that will include 6,000 adults and 2,000 children. The multi-site health study will look at the association between health outcomes and PFAS drinking water exposure. Again, very, very similar to the exposure assessment. The PFAS contaminated sites can either be industrial or military. Since the study is focused on PFAS exposures from drinking water, persons with occupational health exposures to PFAS, such as firefighters, will be excluded from this type of study. A total of 7 partners working with 7 different communities across the nation have been awarded this grant and work with ATSDR on this. The goal of this health study is to learn more about the relationship, again, between PFAS exposure and health outcomes among different populations. Again, what's important to note that although studying cancer is not part of this multi-study, CDC understands that addressing cancer is a major concern, not only here locally, but nationally, and will continue to consider other possibilities to look at cancer in the future based upon the information they gain from this one study. Understanding the relationship between PFAS exposure and health outcomes will allow communities and governmental agencies to make better decisions about how to protect public health moving forward. So that's a multi-site health study. There is one locally, and that's called the Pease Health Study. This study will serve as a pilot for the multi-site health study, which I just mentioned, and will look at the association between health outcomes and PFAS in drinking water exposure. ATSDR will collect blood samples and urine and administer questionnaires and administer childhood neurobehavioral testing and communicate with impacted community members. Pease study data will be integrated with data from the other sites that I just mentioned in the multi-site health study to maximize the impact with all these studies. This, again, just to be clear, isn't focused on cancer. It's really focused on chronic disease, increased cholesterol, and developmental delays among such children. So those are the 3 big health studies that are out there. You'll hear in the community, Colonel Pogora mentioned it, the term Pease used in other types of studies. So there's the Pease Public Water Health Consultation, and then there's the Pease Private Well Consultation. So again, those are focused more on the contaminated, as you know, back in 2014, the Haven well was identified having high levels of PFAS in it. So there's still work being done on that end. And then they're all ATSDRs also starting to look at private wells that may or may not have been contaminated with PFAS during that same time period. So those are the national studies that are being led by ATSDR and CDC. Karen's here, Karen Craver from the Department of Health and Human Services. They are linked into those national studies with CDC. They are working on biomonitoring as a part of some of those studies and continue to support the work that's happening not only here at Pease, but certainly that ATSDR is doing in the region as well. And she's here obviously to answer any questions that you may have regarding these types of studies. So I'll stop there and we can move on to USAF Sam.
Good afternoon. My name's Colonel Tess Goodman, and I am the commander of USAF SAM, or the United States Air Force School of Aerospace Medicine. Sorry. I wanted to quickly tell you about what USAF SAM is. Colonel Pogorek did a great job of describing it from our bio. But truly, USAF SAM's mission is to optimize and sustain airmen health through world-class education, expert consultation, and operationally focused research. We're centered with the Air Force Research Laboratory, and I hope that gives you confidence. We are surrounded by a vast number of expertise within the Air Force, and our directive and our mission is to provide research to push the forefront to make sure that we're meeting the needs of the Air Force and the population in the Air Force. The Air Force often looks to USAF SAM, in particular the Surgeon General's office often looks to us and our Epidemiology Consult Service to lead or assist in studies to better understand the health of service members, both past and present. The Air Force chose USAF SAM for this particular study to partner with you and make sure this study went well. Thank you again for inviting us, sir. We're happy to announce the study in response to the occupational health concerns that this community raised regarding military members stationed at Pease and Pease Air Force Base and Pease Air National Guard Base. We took your concerns seriously and have worked with Wing, New Hampshire State Public Health Leadership, the Guard Bureau, the Air Force, and others to develop this study. The study will look at cancer deaths of Pease Air Force Base and Air National Guard Base service members from 1970 through the end of 2018. This study is a step in gathering data to allow informed decision-making on how to proceed in the future. This is a true partnership requiring the base, the Guard, Air Force Personnel Center, and others to gather the personnel records of service members stationed at Pease from 1970 to 2018. And once we have the necessary records, they will be used to establish the military members' presence at Pease and to comb mortality registries to find cancer deaths by various different cancers. We anticipate this study will take our experts 1 year to complete as soon as we have the data available. I will defer all the specifics of the study to Major Weber, who will be right after me in this conversation. In your listening sessions over the past year, service members, spouses, and retirees expressed concerns, and you asked us to help find out if something is going on here. This study is a step toward answering your questions. We appreciate your invitation to come up from Ohio and answer your questions about this study. Our team's core purpose is to support airmen, both past and present, and we appreciate your time and patience as we get this study started for you. Any questions for me right off? So to talk about the absolute particulars of the study, I'd like to introduce Major Weber, who is our public health expert and lead epidemiologist on the study.
Well, good afternoon, everyone. I'm Bryant Weber. It's really a pleasure to be with you today. In our office, we conduct a number of studies for various Air Force installations, but we hardly ever get to actually come to the installation and talk about our study. This is really a distinct privilege for us, so thank you for having us. I'd like to just outline the study, and then we'll take questions after that. So what we've designed is something called a retrospective cohort study. So it's retrospective because all of the outcomes have happened in the past. And it's a cohort study because what we're analyzing is a cohort or group of people that shares a common characteristic. In this case, that characteristic is having been assigned to Pease Air Force Base or Air National Guard Base during the time period mentioned by Colonel Goodman, 1970 to 2018. And then we can compare that cohort to another group of people that didn't have that exposure. So the outcome of interest in this study what we're really looking at is death from cancer. This includes all cancers together and particular cancer types. We're going to get this information by looking in something called the National Death Index Plus. This is the repository for mortality information in the United States. It includes death certificate data on nearly everyone who died in the United States beginning in 1979. And so we're going to acquire this data, and we're going to look for our service members who were stationed here between 1970 and 2018 for any cancer deaths that they had. Then we'll be able to determine how many cancer deaths we would have expected based on the general US population data, accounting for the age, gender, and race and ethnicity of the population. So to give you an example, say we find that there were some prostate cancer deaths in that group of people. And say when we look into the general US population data, we would expect there to have been 4 prostate cancer deaths. And this is totally hypothetical information, but we'd say, okay, we think there should be 4. But in your population, we actually found that there were 8 prostate cancer deaths. Then we would be able to say that the prostate cancer death experience here at Pease was twice as high as we would expect based on the general population data. Conversely, if we expected 4 prostate cancer deaths and we found 2, then we'd say the prostate cancer mortality experience was half as high as we expected. And in addition to doing all of that, we're also going to be able to look at certain variables of interest, for instance, the military occupation individuals had while they were stationed here, and the time on service, and even break it down by component, guard versus active duty. So as was already mentioned, we get all this data in, we're going to do this study, which should take us about 1 year after we receive all the personnel records. Once we look at those differences, we're going to be able to tell whether or not, using statistical methods, that difference was either something that you would see within statistical variation, or if it could be due to something else. When this study is completed in about that year time frame, we're going to produce an official memorandum. That's what we do for all of our studies. This memo will be shared with Colonel Pogoric and other Air Force leaders, and we'll figure out the best way to disseminate that information to you all and the general public. This memo is going to look a lot like what you would see in a scientific manuscript, a peer-reviewed medical journal, where you're going to have the introduction to the study, you're going to see our methodology in great detail, all of our findings. We will put everything in there, things that look to be interesting and things that maybe didn't look so interesting. We'll have all of our findings in there, and then we'll have a discussion of what those findings mean. We also occasionally do publish our research in medical journals, so there's a chance that you could see that down the road as well. So at this point, before we take questions, I just wanted to give one note of caution. And that's to say that when we do this type of research, which is known as epidemiologic research, we're not going to be able to say that we found that being here at Pease caused someone to either develop cancer or die from a cancer. All we're able to say doing epidemiologic research like this is that there was an association or no association statistically between being assigned here and that cancer death. And again, all cancer deaths or any individual cancer type. I hope that clarifies kind of the thrust of what we're doing, and if there are more particular questions, I'd be happy to try to answer those. Thanks. Yes, ma'am.
So do you choose the members to be in the study, or do the members apply to be in the study?
So every person who was assigned here, again, this is active duty guard reserve, between that 1970 to 2018 will be in the study. Yes. And they do not need to reach out to us. We have those records, and it's within our purview as the Epidemiology Consult Service for the Air Force to do this type of study. And the study will be shortly approved by the Air Force Research Laboratory's IRB, which is our regulatory oversight, to make sure we're doing the study in an ethical manner. Sir, I think I saw your hand first.
2 questions. When you're comparing these statistics to Pease against those at Plattsburgh, and the reason I ask that is Pease and Plattsburgh were the only bases that carried the SHRAM, short-range attack missiles. And those were removed for the inventory for cause. So I'm wondering if that went into it. That's one. And the second part, the more important part is, now that we found out or we have an idea, because you just answered, you're going to contact all of these former members. And let's face it, most of them are our age or older, which makes them pretty much senior citizens in those periods. What are you going to do for these troops?
So on your first question, this particular study is looking just at Pease. And we're going to be comparing those individuals to, again, the general U.S. population. So we're not comparing to another base or even to other service members. It's really a comparison to the general U.S. population. And this is a way commonly in our country that we do this type of cancer mortality epidemiology. Now, regarding your second question, I may have misspoke. We are not actually going to be contacting individuals. All the data is going to be collected behind the scenes using death certificate data that are in the repository known as the National Death Index. Is there a follow-on?
Follow-up,
Yeah.
yes. So basically, we're waiting for these people to die in order to test them, rather than contacting them now. We know the United States Air Force has the ability to reach out and contact all of these former members and ask them to participate. But from what you're saying here, it looks like we're waiting until they die and then we're checking this, which kind of looks like the management plan. And I'm not blaming this on the Guard, but I am blaming this on the United States Air Force. It was their problem to get made. Now it's time to stand up for these troops and take care of them.
Yeah, and we absolutely agree with that last comment. The study itself is a mortality study, so it is relying on that outcome. So it's not looking at current cancer diagnoses. It's looking at individuals who have died from cancer. That is a separate study, yeah, it would be a separate study to contact individuals and get health records. Possible? Yes, possible. Would take probably a very long time. I wouldn't know the specifics, but would probably take a very long time.
I can tell you 2 parts just to add to that, just so in case you didn't know. One, during the 80s and early 90s, all of our troops that had maxed out their time, left the United States Air Force, were brought back and tested, all for a 2-day test period to see where they were at. Furthermore, I can tell you when we were shorthanded after 9/11, we were all recalled to active duty, they had no problem finding people that hadn't been in the service for 10 years and bringing them back. So I'm fairly certain they could find some of these people just by looking in their database if they wanted to.
Yeah.
Thank you.
Yes, sir. Your absence of mentioning civil service workers, contractors is fairly obvious. Is there a reason for that? I mean, and by the way, we apologize to the Air Force that it's inconvenient to find people that are alive as opposed to dead. I think you should focus on the living as well as the dead. So please answer, why are we eliminating civil service and contractors
Yeah.
who made this base run, as well as the GIs and the families that live here?
Yeah.
And take it from there.
Yeah. Yeah, it's an excellent question. Now, our purview or our jurisdiction as the School of Aerospace Medicine is to focus on the service members, active duty, Guard, Reserve. That's who we have data on, and it's who we're able to study. And we hope by doing this study that we're providing a piece to a larger puzzle that will then get combined with other scientific research going on to help try to answer your concerns. But really, we're doing the best study we can do with what we have available.
Maybe I could just help with a question, because I think what they're getting at is there's a concern, are we able to do, what's the correct term for someone that has had cancer or currently has it? That's
Correct.
Incidence. Can you talk to us a little bit about why we went with a mortality study versus a cancer incidence? And there's only so much your organization can do, but maybe there's another one. But can you talk to that a little bit?
Right. So, thanks, sir. So cancer mortality studies rely on, again, death certificate data that are centrally located in the United States in this database. Unfortunately, in our country, fortunately or unfortunately, we have 57 different cancer registries at state, territorial, and municipal levels. And to get objective data that would be scientifically valid and useful would require going to all those databases. And oncologic researchers at the National Cancer Institute or the American Cancer Society, they will spend a decade getting data from 57 registries to do a study like that. It's not to say it's unheard of or impossible. It just requires going to all these registries and getting the data, which is something we don't have to do in this study. We can go to the one source and have some objective findings for you.
And I would think what I've heard is that's a little bit beyond your capability, but there are other organizations maybe that could do that, and there's ways to go about that. But this School of Aerospace Medicine, that's beyond what they can do. They can't offer that to us.
So Major, just to go back to the very first question that was asked, just a simple clarification.
Yep.
This study is focused on the mortality, on people that have already died. So anybody that's here present that served during that time that may have cancer, they will not be included in this study. Because I was confused when you answered that question the first time.
Yes, ma'am.
So
It's
it's totally mortality.
totally mortality.
Okay.
Mhm.
What would
Sir.
you do with the results in a year from now, let's say it's cancer weight or whatever it is, higher than the national average or other air bases or military installations? What will that accomplish?
Yeah. So again, I think this is how science progresses. Is one study gets done, it provides a piece of the puzzle, and then others can use that information to design additional research. Perhaps if we find that one cancer type stands out from the others, then that points you in that direction. Every cancer is unique, and so it points you to maybe a different pathology, maybe different exposures of interest to look at. So we hope we're going to be advancing the science by doing this. But again, we're going to share all of our findings. We're not going to just report things that we think are interesting or statistically significant. We're going to provide all the information back, and we'll see how things progress from there.
You share the frustration when you go forward with some of these issues and concerns is, well, we are sad that people have died from diseases that may be related to exposure. There are people in this room right now who are retired, who had that exposure, who did alert, who were exposed to those PFAS.
Yeah.
And even though we or they may be in that other study, this study is driven totally different. So I think that's where there might be some confusion on why this was a valuable thing for people to attend. Because it's basically driven on deaths.
Yes, and we understand the frustration and concern, and we obviously sympathize with people who currently have cancer. That it's every case of cancer is tragic. Those of us who are physicians in the room, have contested that, of course, and we all have family members and friends. But I think the issue here is we had to do the best scientific study we could, and for some of the reasons that I tried to outline with the 57 registries and the amount of time, the cancer incidence study would be much more logistically problematic and something that we couldn't take on. So this is the best study that we as the Epidemiology Consult Service could provide to you. And we do hope that it does move the needle forward or get the football farther down the field. That's our goal.
And just from talking to you both, and what I've heard from this gentleman, Dick, from Boston University, is that right? And I hate to put you on the spot, but I thought you brought up a great point. So I don't know a lot about these things, but from talking to you, this is kind of the first step of how we go into doing a study. If we look at the Campbell-June model, they did the same thing, which led to a follow-on study, and that seems to be how the science works here. So with the results from this, it may lead to another study. Something will be done with the data, but this is the first step.
And I'll just follow up that the first concern and the first question that we can ask and we can find data for is being a military member assigned to this base, is it statistically likely to cause, or not cause, to be associated with higher cancer incidence to the rest of the public? That drives more questions when that answer comes available. It's not an end, it's a beginning. It's a beginning to say, here's a question, this is a question we are able to find data for, and we are able to narrow down and find a scope that allows us to direct towards certain cancers, potentially. It could, as easily as it could say that there are more cancers here, it could say that they're not. And that doesn't mean that there's not a problem here. It just means that that particular question we weren't able to validate with the science. And so But what any good hypothesis, any good science question starts with is a question that you're trying to answer. And then with the results of that answer, it drives more questions. And that's what we're trying to say. This is a study to start. This is a study to get us in the right direction to answer. The initial question is there more cancer here? And then follow from that. What can we do? What's in the ability of science to test? And then in partnership with all the other studies and in consultations across the nation with other different studies going on related to exposures, related to workers, related to airmen health. All of those things work together in the science world to develop more questions, to answer the current questions that you have, and to try and get to the point where you feel like we're addressing your needs. This is just a starting point.
See, there are a lot of hands, so just maybe go left to right. Sir?
Yes, just curious with the registry, how are we certain that the cause of death is accurate as taken to cancer, like person dies of old age or whatever, as like a secondary part of this individual?
Yeah.
You know, might do a little more.
Yeah, so the good thing about using what we're doing is it's based on death certificate data, which are objective and standardized across the nation and filled out by professionals who have been trained to fill them out. And so it's not perfect. Nothing in science really is, frankly, but it's probably the best objective thing we have because it requires the person to indicate, here's the reason why an individual died, and here are the contributing factors to that death. So I hope does that answer the question? Okay. Sir.
Yeah, I'm one of those guys. I had prostate cancer, and I'm just wondering how that relates to me in the time frame that you talked about. You got to go through this study to find out how many people died of it, and after that, you're going to move over to who might or might not have had cancer.
So we'll be able to look at that group of people, how many people in that group died, and of those, how many of them died of cancer. And again, it will say specifically in death certificates what type of cancer. So we'll be able to look at each of those cancer types. Yes, we will not be looking at people who have been diagnosed but have not died from the disease. Yeah. And I thought there's one up. Yeah, sir. In the green. Yeah, you, sir.
Prior to base closing in '88, I was asked through the 45th Anniversary to go out and find out where the chemicals were. I did so, took the basic medicine. Didn't want to hear it, okay? What am I going to hear? But also, there was also a government report where all these test sites with pictures, diagrams, where everything is in 1983. Why are we talking about going out and I don't see any fresh holes out there where they're digging anything out. Okay? At what point do you start using the stuff that's already been put out? I don't see any new maps that's been out. I haven't seen any of these things. But that map, that study from 1983, is there online. It's got all the sites, including the storage area, and stuff where it's dumped all over the place. Start digging.
Yeah. Sir.
Just wanted to make you aware that there were Army National Guard soldiers that used the medical clinic here in the mid-90s, and then we'd occasionally come over and do some cross-train with the Air Force. So I don't, I doubt there's any way you would be able to know that other than.
Right. As was mentioned with the civil servants, I mean, we obviously care just as much about Army Guardsmen as Air Force, but unfortunately, at least in our jurisdiction, we can only look at Air Force data. However, the results, would likely be what we call generalizable to other people who are here working similar jobs at similar time frames. So hopefully our results are valuable to you as well as the civil servants, contractors. Sir, and yes, sir.
I missed the last meeting. I was stopped at the gate. He wasn't allowed in. And it was through Doris Brock's efforts that we're here today, my friend and I have a presentation. It'll take about 2 minutes to read it. And I think we'll cast more light on your cancer study. My adopted son is 34 years old and has autism. His disability makes him unemployable, but he does have a bachelor's degree. So how is my son connected with Pease Air Force Base? His birth mother arrived at her new assignment at Pease from Italy 3 months pregnant. He was born on July 15, 1985, after being in utero at Pease for 6 months. During this period of time, his biological mother was living and working on Pease while my son was developing as a fetus. Any interference with normal fetal development would have a profound effect on his development as an individual. My wife and I adopted our son 1 month after his birth. We were happy to get a baby, a military baby, because we could be assured that his mother had good medical care and would have a healthy baby. Needless to say, this was not the case. Initially, my son was diagnosed with ADD, attention deficit disorder, in the 2nd grade. He worked very hard with special education teachers all the way through college, and was on the honor roll his last 2 years of college. Since receiving his degree in 2013, he has difficulty staying employed, and when he got a job, he would always be laid off. He was also having problems getting along with his mother and I. We decided to go into family therapy. 2 neuropsych evaluations determined my son has high-functioning autism, until recently called Asperger's syndrome. I have several science degrees, biology, chemistry, and environmental science. So I started doing research on the internet to see what my son might have been exposed to while in utero at Pease. I discovered that PFAS was in the water supply at Pease since the 1950s. This is the same chemical made by DuPont that Bill Ballot in the movie Dark Waters legally proved caused multiple diseases. This chemical was found in the water supply at Pease in 2014. Furthermore, I found that Pease was declared a Superfund site in 1991, and that prior to this, there was uncontrolled disposal of hazardous waste. As my son was born in 1985, before these discoveries were made, and because his mother lived and worked at Pease, he developed in utero and a toxic soup ingested with the polluted water his biological mother consumed. I have his pre-adoption birth certificate to prove that he was born here and when he was born here, and a public record of widespread pollution at Pease. In addition, current scientific evidence indicates that these pollution can harm fetal development, not just by causing cancer, but by causing neurobiological effects. Asperger's syndrome is a neurobiological effect. I have not heard any mention of any study that you were planning on doing with regard to neurobiological effects. I have repeatedly met with veterans agents, and the only answer they can give me is get a lawyer. I tried that, and he wanted to charge my son $1,500 to get started. Difficult to do for an unemployed autistic son. I'm 75, living on a teacher's pension, and I don't have much time left to help my son. Spending money on legal help with no guarantees of success when this money would be used to support my son after my death does not seem to be a viable solution. In my research, I happened to meet Doris and spoke to her about my son. She said that I should propose, in terms of the federal government, that there should be presumptive claim for compensation for civilian exposure. I've not heard anything about that. While in utero for 6 months at Pease, the damage that was done to him while in utero at Pease has had a significant negative impact on him currently and will continue to have a more severe impact on his future. Asperger's is incurable. I would like to know if there's anyone out there who can advise me on how to file such a claim.
Sir.
Broaden the scope here beyond cancer, okay? It's not just cancer.
I appreciate you sharing that story. It sounds tragic. I'm sorry this has happened. There are a number of studies. That's one of the reasons why Colonel Brindisi spoke to that. I think it's outside of the scope of this study, but if I can get your name and number, contact information, let's see if we can put you in contact with a representative from ATSDR that is running, Senator Shaheen's office has funded a study for childhood development, and it might be more applicable in your case.
Let's see, what, ma'am?
Basically trying to say is this study is just a mortality study, but it results from this study will lead to other studies that will probably pick up on the current illnesses that people may have.
I think that's a good summary. Yeah. Yeah. We'll start, sorry, back here, sir. Waiting for what?
I've been stationed here 14 years and change. I've gone through 2 cancers since that time. What should we be looking for where the cancer is going to come? Is it in the prostate? Is it in the breasts? What does this associate this carcinogen with?
If I could just, we did, Colonel Brindisi, I'm going to go back to you. So we had our meeting in October of 19. And do you remember the handout that we had that individuals could bring to their primary care physician and have some of those discussions with the attempt of that, of early intervention, maybe doing some testing that could determine stuff before it gets too far. Where would we find that handout? Is that on Bill's website? Okay, did you get a chance to register when you came in? Okay, so that is that something, Bill, we can maybe send out again after this one?
And is there a blood test that we can take to find out if we have these carcinogens in us now? Because I'm still fighting the cancer right now.
My understanding is right now the state is not doing any blood testing, but I really couldn't speak to it.
Is there a test that I can do on my own?
So the state's not doing PFAS blood testing right now. We do have information on our website about where you can obtain PFAS blood testing. It's a conversation we recommend you would have with your provider. It's not necessarily a test that we would recommend medically because having PFAS in your blood isn't necessarily going to guide the doctor's care. It's not an indication that it can be connected.
Has this been said that this is a carcinogen in humans?
To my knowledge, that has not, it is a, if you're talking about PFAS, or it's still a agent of concern, emerging concern.
Isn't it though with the 3M suit and the DuPont suit? There's been several of those suits against those large companies that I believe for sure have used that word, carcinogens. It may not have been used in the concept of where your 4 or 5 studies are. But if you follow 3M, and Doris, maybe you can speak to this at DuPont, there are civilian studies and civilian lawsuits that are with 3M DuPont, am I right? And they do use that word. Yes, like the CRS study. So that answers your question. If you have your PFAS blood work done, I would say the same thing I said the last time to the flight surgeon who's here. Your doctors do not know, your local doctors do not know what to do with them. They can perhaps say maybe you can have a CAT scan, but you have to have some symptoms. You show them that PFAS and said you have high level, they do not know what to do with it. They do not want to do presumptive letters to try to follow through with what the Air Force and Guard is expecting us to do with meeting with the advocates. it's very tough to get a doctor to write a presumptive letter, whether it's local or Mass General or further out of our scope. So to answer your question, you can get a PFA test, correct me, Doris, you have to pay for it yourself. Your doctor isn't going to necessarily know what to do unless you have symptoms of some form of cancer. Correct me if I'm incorrect on that. I don't think I am.
So I'm the wrong person to talk to you about the PFAS, PFOA. I can talk to you as a physician. And so a couple of things. To re-vector back to this study, the first question you asked her was, which cancer should I be looking for? What directed and target? So that would be one of the questions that we could get closer to with this particular study. If it comes out and we find particular cancers, people are dying of particular cancer more so here. That's correct, but that's what, but it's to give us information to target and go to a different level, sir. And it's the information that we can get to and we can get to relatively quickly, and that will allow us to answer further questions potentially. As a physician, true, a PFAS test, we in medicine don't know what to do with that because we don't have scientific evidence yet. There's legal evidence, and the court of law is much different than science. And so it's a different burden of proof and a different, one is a jury opinion, and one is the rest of the scientific community, the academic community. And then to answer a third question, I think you asked about, is there a test for cancer? Differing cancers there are some cancers that can be detected through tests. There are some cancers that cannot. And so it's very difficult, and that's why cancer is such a tough problem. And again, to go back to this particular study, it would be really nice if we could come out of this study and be able to tell you these are more likely cancers at Pease Air Force Base, if we're able to find any ones that are statistically different from the general population.
Well, start back row. Sir, your hand was up first.
I was here on active duty in the 509, and I had a lot of friends who lived in base housing. Are you going to include their non-military spouses, their children, in your study? Because they were exposed to it a lot more than most of the military members. They cooked with the water, they drank the water, they bathed in the water. So their exposure might give you a greater indication of an effect, cause and effect.
Yeah, again, unfortunately, based on data availability, we have records on the service members, not the dependents, not the spouses and the children. And again, the exposure is just being stationed here, not so much water or being associated with any type of soil or other exposure. What we can be able to say through this study potentially is if we stratify the group in different amounts of exposure time, so the people who are here a long time versus people who are here for just a short time, if there's differences in those groups, that kind of clues us in that maybe there's something going on, that there was an exposure or exposures that led to this difference that we're seeing, which again leads on to the next step in the next phase of research.
Well, that's part of the concern, because I lived off base, so my exposure to the water, even though I pulled alert, was relatively small, as opposed to my friends who lived in base housing with their young children. And as I say, were exposed to the water all day long, every day. And so they're now in their middle age, and they would potentially be a source of data points for your study. And I think we should make the effort to identify those individuals.
And sir, I would just say, we had talked about those other studies, and some of them maybe would address your population. You're talking about people that were young and maybe grew up on the base. Unfortunately, we can't ask these folks to do something that is beyond our capability. It doesn't mean that we can't make other efforts. Maybe it's a different organization. Maybe there's someone else we approach. But there are other studies that you just want to get smart on which population, and it may be one that's addressing your concerns.
Sir, I'm hearing more from this group about the effects on their families. have to say is video recordings were formally made at the past 2 hearings. At both hearings, 2 former 509th Security Police Lieutenant Colonels, who I was being told what to do by it, spoke of how contamination affected them, their families, and their friends. Sir, the videos were maintained by 157th, I suppose. All of those who spoke did it so with the understanding that their voices and experience would at least attest to the serious effects of these contaminants. I came in through with, the chain of command. It didn't only flow downward, it flew upwards too. It didn't end upon retirement. The reading these lieutenant colonels from that video and what they had to say changes my whole perception of this. They did it with, best intent on what they had to say, but why, I want to know, is why it was their testimony, which was identical to the first video, deleted.
Sir, which videos are we talking about?
The second one.
The meeting here?
Yep.
Or did we edit any of the videos?
Yep, 2 lieutenant colonels, one sitting right behind me towards you and Colonel Miguel.
We're not aware of anything that was edited, sir. I think they were.
It fell out on the cutting room floor, sir.
Okay.
I'm sorry, I'm not trying to be too sarcastic.
We're trying to be very transparent, and as far as I know, our mandate is what we filmed today, we put out. So no editing, nothing taken out.
Gentleman was asking a question outside the room. There is the Pease study, the independent study, that is conducting PFAS blood test and urines and samples.
It's not conducting, you've already had your PFAS blood tested for that other study. If you did not have it, if you did not have your blood tested for that PFAS, for the ATRBCDQP study, then you're not including that either. And my understanding is there were a lot of people tested, but only a couple hundred have signed up for that, and not as many children as they want. But that's all based from this study that you're speaking of. The key to all of this for me was having gone and gotten tested for the PFAS when it was out in the general public, and there were stories in the Portsmouth Herald when Bonnie was sending out information about it. That kind of was somewhat of the key. If you missed it, there was no word, you didn't get PFAS blood done, then you're kind of in the middle. It doesn't mean that you're not going to be looked at future studies, but would you agree that that PFAS study, blood test, has been key for a lot of this to be included in that national study? Jean Shaheen's study is the study y'all are thinking about now, which is the mortality study. And here's the frustration. It is what it is. It doesn't help people in this audience who have bladder cancer, prostate cancer, who were pilots here, who learned, who did whatever they had to do here at Pease.
I would just say, with so many studies going on, I would be hopeful that they start to show some results that can be used, and I think the term used may be a generalized thing that would apply to many more people than just the folks that were in the study. It would represent a higher population, and then maybe we drive further studies and then some action at some point, if necessary.
And we should all be thankful for Senator Shaheen and Chris Pratt and others, and you all that have moved some forward. It may not be exactly where everybody would like that PNC to be, but at least we're kind of moving forward. We have a station in K.I. Sawyer, Michigan. Everybody knows that story in Michigan, how difficult that is. We have a station in Georgia at Moody Air Force Base. That is also in the top 100. So it's nationwide as well as Pease. Thanks to Jean Shaheen and Doris and others, we've been somewhat lucky to at least get to this particular piece. It's not going to answer everybody's frustration.
Yeah, I think through the efforts, like I said, this was a team effort to get this study. We're the only international guard base that's going to have it, and maybe the only Air Force installation that will have this. So this will be applicable to others, I would think, depending on what the findings are.
Can
just make a clarification. Peter from Senator Keating's office. And the Pease study that you were talking about, the first wave right now is folks who had their blood tested previously by the Department of Health and Human Services. The big study, yes. And it's our understanding through ATSDR that there could be a second wave of that study that would be it would be open to more of the public. So that's, Senator Shaheen and members of Congress, we helped with the funding of that study, but we did not actually write the parameters of the study. So that's a question for ATSDR about that second wave, when and if and when it will be open. And certainly we can connect you to ATSDR with those questions.
We still want JG needs to know how much we appreciate the least portion of the sheet is on to collect that money to bring it back to Pease.
Certainly, but we'll talk after and I can get you connected with ATSDR.
So basically, these tests are put in the door to hopefully get the ball rolling for these tests that are going to have to take place for the other individuals that are in this room, is what I've been hearing. You did say, and I think it might have got a little confused, that you're going to have to draw the information, and then from that point, it'll take a year. So how long do you think, this is the first question, how long do you think that it'll take you to get the information and start your one-year test?
So I believe they have all the information except for Guard members that have served here from 1970 to 1979 approximately. You already have all the data you need. So that really falls to us, New Hampshire and National Guard, to get that. We did our training earlier in the week and we started collecting that information. We just started because we need to get all the parameters. When they look at the study, they need certain data points. AFSC might be one, male or female, when they started serving. So once we have that, which we just recently got, I anticipate by the end of February, we'll have collected that, and I would think shortly thereafter, I don't know your time frame, but 1 March, you would have all the data.
So then out of that information that you get, could drive not just PFAS, PFOAs or whatever, could drive the other chemicals that were possibly in the wells or whatever that we had, to tell you what kind of cancer might have been affected.
Right.
Is what you're kind of saying. You have to get this train moving before you can get down to that final endpoint, and it takes a long time because the June took 36 years. We're actually lucky right now to even have you standing here in front of us, right? So, I mean, thanks for coming to do this. I mean, it's not, a mortality rate is probably the easiest kill, so to speak, to basically take care of, to get an idea of where we're at. That's what we're doing right now.
Thanks. Yeah, it is. And to clarify, the timing, so once we get that, all of the personnel data, our 1 year approximate window would start then. So we would, if we get it by end of February, we'd hope to have the study finalized and back to Colonel Peork, all of our answers by the end of February 2021. So 1 year period. But yes, I think it's important to keep all these different studies distinct. And we're laser focused on this mortality study and doing the best one possible so that the results are actually valid and usable. And the scientific community can hang their hat on something and say, okay, this makes sense because this study was done the right way. And so that's our focus right now, and that's what will be for the next year. And hopefully we get that back to you even sooner than that, but we anticipate 1 year.
And just by us having our membership card at some point in time between 1970, that means we're automatically in this.
Yes, sir.
Your data is included,
Yes, sir.
This Pease is one base, obviously. How about all of the other bases across the country? I mean, you see numbers like 150, 400 bases and similar contamination with PFAS. What about that?
If I could jump in real quick, I think they're answering the question that we posed them. So we didn't pose a question about the other bases.
Okay.
We posed one about Pease.
Right.
And that's the concerns that we heard from Doris and a number of others back in August of 18. So they're answering the question that we posed to them.
Sir, if I just could, as I touched on earlier, the exposure assessment that ATSDR has started does include 8 additional international databases looking at PFAS exposure.
And to go back again, the question that was asked, there were numerous things that came out of the listening sessions cancer being a large question that came out of that. And so in order to try and find something that we could get our foot in the door, I think is a great way to talk about that. This is a study that we can do, and we can deliver valid data. And that will give us a lot of questions to answer later, and can drive the train further down the road. And those questions may not be us that are answering them, it may be a larger scale study that's driven either through your representatives or through ATSCR or through any number of registries. But it's absolutely the initial way, and the thing that we can get you an answer to quickly, data.
I think, sir, in the back.
Just an administrative question here. I understand where you're going from. Great idea, the study's a great idea, but I understand you got to be deceased in order to get into it. But unless a deceased individual never privately stationed here, unless they get compensation, such a retirement check from the Department of Defense, when they die, I've handled a number of deaths. I didn't see one in there where the Department of Defense got a death certificate. Do you take the population and cross-reference it with Social Security to make sure these people are still alive? Because I know of 2 guys who had cancer, died after they were left here, and I don't know how their records would be reconciled so that you would get the correct information in your database.
So it's a great question. So all 50 states and District of Columbia and Territories submit death certificates to the National Center for Health Statistics, which is a center under the Centers for Disease Control and Prevention. So it's not a DoD specific thing, it's the entire country. Obviously, folks who die outside the United States, those death certificates usually don't come back here, and if they did, they have different parameters in other countries on how they fill out death certificates. So as we talked about earlier, ours are very standardized. So it doesn't matter if they're, we're affiliated with the DoD in the ways you were describing. The fact that they were in our cohort or our population and they were found in the National Death Index Plus, we will capture them.
You bump your population against that database.
Yes, and there's a well-validated mechanism they use at the National Center for Health Statistics to make sure that it's the right person, using combinations of Social Security numbers, first name, last name, their gender, and their birth date. Sure.
This is the first time I've been to one of these meetings. I've heard all about all the problems they're having with PFAS and all this stuff. I've never been notified about anything. The only reason I know about this meeting and the only reason I've heard about this situation is just through my friends that I was stationed with, just talking amongst ourselves on Facebook. Is there any way that you know or have a list of everybody that was stationed here during the time frame we're talking about? And are each one of them individually notified about any tests or anything going on that they should be a part of, or blood tests or whatever, concerning PFAS in the water?
So, sir, we have a list of people that have served here, but they could have moved, if they haven't left any contact information, that doesn't mean
I just live up the road.
Well, that's why Bill here has the registry we talked about. So while you're here, if you fill that out, we can keep you informed. But it's a database for buildings. So sometimes someone retires from here, we also have a database that we fill out. Dave Mann owns that one. So we do try to keep everybody up to date as we can.
I can understand it be a difficult thing, but anybody I've ever talked to that knows about the situation, I've never talked to anybody that's been officially notified to come in for a blood test or anything. Everybody's heard about it on Facebook or just on general conversation.
I don't know, Derek, is there anything you can say about that one? Was there ever a letter that went out for blood testing or not to current or former members?
The original ATSDR study, which is known as the Pease Health Study, the blood testing was conducted a couple of years ago, and it was in the newspaper, and they tried to promote that to encourage folks who lived in the Pease treatment area who may have been exposed to the heating well, drink water well, go in and do blood testing. But it was pointed out that there were some people that took advantage of it, and then some folks heard about it after the fact. I think the state reopened it one additional time for those individuals that heard about it after the fact. It's been closed those things. So I think we always try to do the best we can as far as public messaging, trying to get information out, trying to use social media. And not everybody uses that, but the typical newspaper is probably our primary news and communication.
Plus, testing for Pease is on Facebook, correct? That's something you can follow if you're on Facebook. That provides a lot of that information. Connects you to other places where you might be stationed, or connected with Michigan, with K.I. Sawyer, with Moody. There's many different things if you are on Facebook that will help you get to some of that information.
So my name is Bill Goodrow, I'm the director for the State's Division of Veteran Services, and we do maintain a contact list. Been maintaining it for just over a year, and tragically, there's only about 320 names on that list. So, as you mentioned, sir, you only know about it because other people told you about it. Word of mouth is a great thing. I wish that list had 10,000, 20,000 names on it. But then people aren't going to know about it until other people tell them about it. I mean, a simple question to ask, I mean, people have mentioned how the Air Force has reached out to these people. When you move, did you tell the Air Force you moved? When you get a new phone number, do you tell the Air Force you changed your phone number? So people do separate from the military, and the military does lose track of where they work. So we need to rely on each other to maintain the network. And again, our database is not the end-all be-all, but it is a network, as well as your network. Yours has a great network of Facebook folks. So this is how we're going to keep this information out. So to take this information home and sit down and not do anything with it, not tell friends and family or other people who have served this area, this is where we're losing that. So I ask that you reach out, if you're on our list, let other people know, have them contact my office so we can get you on the list, so I can expand that out, like a kind of like an old school phone tree.
So by signing up here today, I'd be put on the list?
If you signed up today, you're going to be on the list for our contacts. So whenever anything new comes up with this, if there's a new study that's going out, if, for example, when we got the video from the last one, we put that out. As we start doing this, we'll put that information out. If in a year or 2 years of the VA waves as a magic wand of presumption, I would put that out on that so everybody would know, and you wouldn't have to wait for that to be told to you later on down, from somebody else who heard it from somebody else. So again, that's what we're using this contact list for.
These are good questions. Keep them coming.
Colonel, can I just add one more thing to that? I would like to commend WCSH Channel 6 and Vivian Lee, the reporter from Channel 6 News. But unfortunately, she's from Dayton. Jeff McInerney, I hope I got his name right.
McInerney, yep.
Seacoast Online has been giving out pertinent information on where we're at. My only critique would be, it would be nice if the New Hampshire news station, I won't mention their call, would take interest, because I've had people asking me at my local community center, hey, I saw you on TV, blah, 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 and this and the other, but as we all know, the majority of the people probably are in New Hampshire who are present and former members of the New Hampshire National Guard.
I consistently, as I did with Vivian today, thank them for the coverage, because we need this coverage. It helps us get the word out. So I agree with you.
Is the study limited to cancers or all deaths?
It's limited to cancer mortality.
Okay. So a number of people, many of us know of other causes, who are stationed here, active duty, Parkinson's, et cetera.
Yes, sir.
Just some piggyback information, what you said about the blood test, the state grant. I was under the impression they took a lot more than several hundred, maybe not. That was the summer of 2018. I came, I gave a blood sample. The last I heard of it, I got results back, put it in my drawer, thank you very much. The summer of 2019, I was contacted by the state and the CDC and asking permission, would I share with them my blood sample results from the PFAS. I went back indicating I would. I was contacted by the CDC in Portsmouth, where they set up a temporary office. I gave another set of samples to them. The screening process, unlike here, is much broader. They didn't They didn't ask if I was military or civilian. They wanted to know, did I have cancer currently? Was I a firefighter? And did I work or live at Pease? Well, their questions mainly revolved around being a firefighter and did I have cancer? So that sample was given to them in September, October of this last year. I was actually paid for that. They were looking for another 1,000 people, either from Pease or people who had never lived anywhere near Pease or never came on base, to do the same sampling so they would have some background on it. I don't know if this is new information for people at home, but they're still sampling, and that's another test, Carl. Thank you very much. The narrow scope that the Air Force has chosen for Pease is wonderful. It's a great first step, but there are other studies out there. And by the way, I got a follow-up letter from somebody, just because from the CDC, I have been included in a multi-million-dollar lawsuit against 3M just by doing the sampling. I don't know where that's going. I don't care. I got my $25 certificates from Market Basket, and I was unhappy. But I'm alive to tell about it. I don't have to die to talk to the Air. Well, thank you for what you're doing so far. You know it needs to be done. Sorry.
Study that he's referring to, I just had my blood test at the beginning of January, and they told us they were going to reopen the study in February. Unfortunately, I don't have that number with me, but that was picked up at the office in Portsmouth.
That study is still open. They are still looking.
Is that at ATSDR or CDC?
That study is still open and they have looking for people. It's beyond 200 or so, because we are in the same situation as you are. That was at the Holiday Inn. We went, we saw the presentation. You signed up for that study. You got the follow-up. That's what I call the ABCD study, because I'm not mixing up the P's. And if you tested people, the PFA has something wrong here. They are still looking for over 1,000 people, including or excluding 600 children, right, to begin that study. And
So that's the Pease Health study that I mentioned earlier in my talk. And again, that's focused on those folks that consume PFAS contaminated water. Originally, ATSI was looking for 1,000 jobs and about 350 children. And then they wanted about 350 folks that didn't consume the water as a check. I don't know if they've expanded that to include that cohort to be larger than the 1,000.
I don't think they've met their 1,000.
But yeah, so I know that they were recruiting individuals to meet that number. Again, ATSDI is not here right now. They could speak to the current environment as to where they're at with that, but that is the Pease Health study I referred to earlier. And that is based upon they originally wanted those individuals that had been blood tested from a couple of years back. That was their original intention, but they didn't think they hit the mark, so which is why they reopened blood testing.
So how would you contact someone, like you said, I don't know who those people are, or what phone number to call, or what do you even say? I heard about a blood test. How do you go about contacting these people that are putting out all these requests for blood testing for cancer? Where would you go to do that? You say you have several different studies.
No, those aren't our studies, but I'll open that up to the crowd. Can anybody help the gentleman out? How?
You have to have already been tested. Will you step in here with me and support me on this? You have been to do.
Right now, you had to have been tested, okay, to be part of that community, to be allowed in this study. If they open it up to other people, okay, there will be an announcement either in the local papers, and they will aggressively, do a lot of local media coverage, to open it up to other individuals. But the criteria, and correct me if I'm wrong, is that you had to work or live in the Pease community from January 2000 to 2014, or is it 2004? I think it's 2000. So if you worked or lived in the community prior to that, you have to include it in the study. ATSDR has some great resources available online and information about the studies. I wonder if we can, I'd be happy to compile a list of links and maybe we can send it out for Bill.
Because I've never been tested, this is all brand new to me, I've never been tested for it, I've never had any medical problems, ever been confident to do so. So, how would someone like me, who doesn't know anything about this is my first meeting, get started again, finding out all the information about this, not only for myself, but the people that I know that are in the same boat?
Hi, Patrick from Pease's office. Next week, ATSDR is doing an update on the PFAS study at the New Hampshire Department of Environmental Service office right here at Pease, 222 International Drive, Suite 175, and that's from 6 to 7:30 p.m.
And that's for people that were on Pease from what date to what date?
So this is the wider, the ATSDR study that we're talking about.
Yeah, you said 2000.
But so if you want more information about that study, you can contact our office, any of our offices. So it's next Tuesday, February 4th, from 6 to 7:30 p.m. at the New Hampshire DES office here on Pease, 222 International Drive, Suite 175.
And as you can see, this is going to be a team effort, right? No one seems to know everything, but together, we're going to find a way.
If you have,
I'm sorry.
oh no, sorry. If you have internet access or can get to someone who has internet access, I believe if you do a search for Pease CDC, it will take you to a link about the study, and they have a website with some great information. They have a call sign set up, which I personally called, and you're able to get through pretty easily. And they also have an email address set up where you can email for information. But certainly, signing up through Mr. Goodrow and maybe another push out with some of that information could also be another avenue for you or others to get that information.
But you would have had to have been working here or stationed here since 2000. I was back in 1970 and 1980.
So for that study, you have to be working or living in the Tradeport area going back to 2004.
And if not,
And you wouldn't be eligible for that study.
Obviously, I know. Is that study also eliminating firefighters as well?
Yes, it does eliminate firefighters and anyone who may have been occupationally exposed to PFAS.
So
Again, they want to focus on drinking water that was contaminated with PFAS.
Right, so the question I have is I have the audience, what are we doing about the firefighters that are stationed at Pease, then at Pease, all the back in Pease, all the way through active duty, transferred to the active duty, then guard, to include state employees? I haven't found a study yet that's actually
Bill,
showing what the.
didn't we, when we had our last meeting, didn't we have a representative from NIOSH that was here and was discussing the fire?
Yes, and I made contact with that, but that's not including firefighters.
Well, I thought hers was specific.
That's contemporary fire.
Yeah, so.
They're addressing the canaries. We're the canaries. We were the firefighters. We got the crap all over us all the time. We're the ones that have the cancers, and there's a blind ear to us. Why not come to us? I checked with the VA system, through MVP. They're trying to draw 1 million veterans, but they're doing a lot of genetic research to see if there's a tendency of certain diseases based on genetics. And there's a lot of money associated with the farmer groups, probably. But come on, a simple query.
With an AFSC, and I know there's other statuses here, but we do have a military status for firefighters. There is an AFSC associated with that. Couldn't this study reveal maybe a higher rate of cancer mortality compared to the general population? Could something good come out of this?
Yeah, absolutely. So again, it's mortality, but we're going to look at occupation. So if the AFSC of firefighters is one occupation we look at, or we group it with other people that we're told are higher risk, then we'll do that.
57150, 57130,
Yep.
57170.
So-
That's it. I didn't know you were going to have that as part of your.
Yep.
Excellent. That answers my question.
I think it's gentlemen.
The fire, the foam for putting out fires is so popular. Why did I see pictures of people, military men, with pieces of plywood pushing it out of the hangar?
So when did that happen again?
I don't know. It was must have been fairly recently, whenever they had a test. I've seen these pictures, training.
I think he's talking about like the Ellsworth foam dump inside of a hangar.
Okay.
After they get done.
That wasn't here?
No.
Yes, we did.
There could have been one that happened because of that.
I'm saying that might happen. The system blew and it filled up the entire hangar. We didn't shut the doors in the hallway. We have an incredible blob coming out.
So,
we literally had to close the doors down by phase lock to keep it from coming out.
I'm going to ask Autumn real quick though. Autumn, is there a difference between the AFFF foam that our firefighters have used and what is in the hangar that we're talking about? Maybe it's the same. Is there a difference?
What is presently in the hangar is different. Currently we utilize high expansion foam, which is a foam that is not fluorinated, so it's a different chemical composition than AFFF. That was retrofitted in our hangars back in, say, 2009 or so. So it's been about a decade where hangar 254 and 253 used to have AFFF systems. Those were removed and the AGF system installed in those two hangars as well as in 251.
If we have, and I heard someone say here, an inadvertent discharge of that, what procedures do we have for that cleanup? I hate cleaning the spot, but.
AFFF, we take that very seriously, and again, it's not in our hangars, but if there is.
Well, I'm saying for the hangars, I think the pictures we were talking about was someone pushing it out with a plywood. We don't know if it was here or not, but how would we handle that? Do you have any, or could someone else answer that one for me?
That is something where, right now, we're actually changing out our 2 3/4% HEF to 2% with our new hangars for the added square footage. And we're actually discussing with the city of Portsmouth, or will be, what the procedures are, if that can be discharged from sanitary sewer or has to be recaptured. When we go to commission the new foam systems, with one expected a couple of months from now, as the first one will put back in service, all of that foam will be recaptured and none of it will be discharged.
And Amanda, I hate to put you on the spot, but I'll ask for your expertise as well. So anything that we do today at the base, and probably earlier, but I'm just going to speak to today, we follow OSHA standards for all the things that we do. Maybe there's AFI guidance, but we do follow that. We test for that. We have our personal protection anytime we do a hazardous job. And then there's some career fields that have certain surveillance programs on it, which is maybe blood testing. Can you speak to that very quickly? Or?
Yes, sir. So if we have any hazardous chemicals in any shop, we would go in and identify that, and through testing on Bio's end, which is the shop that I'm in, we would bring that to the Aerospace Medicine Council, and we have, which is comprised of Bio, Public Health, and a flight doc, and they would identify at that council what blood testing would be appropriate for each shop. And we have a number of shops that are currently on the occupational surveillance program, getting exams on an annual basis.
Okay, and then I think it was back in 2018, we had detected, I think through you, some heavy metal contamination in the hangar. We shut the hangar down, and we had a bunch of folks that came up from the International Guard Bureau that did a cleanup of that. So we certainly take it very seriously. Our airmen are our number one priority. We can't do the mission without them. And we also worry about the community, because that's where we live as well. So.
I think what Chief Hardikoff was trying to get to, the point that he was trying to get to, is kind of what I think Doris has brought up in the past as well. It's frustrating that in the VA system and whatnot, that because you work in the occupation, it seems like you're being left out. And like he was saying, like Chief Hardikoff was saying, you can't find anything on where the firemen that were working swimming in the AFFF, pretty much, and in some cases, they did take baths in it for one reason or another. That is not included. To include those prior to 1980 or 2009, whatever, the CE worker who was involved in keeping those systems up to date in the hangars, to include the fire truck mechanics that were swimming in that stuff as well. That's for the PFAS and the TFOAs and all that. That's just for being identified, for even dealing with this stuff. It's not just firemen, I think is where I'm going with it. But Bill can't find information for the fireman piece. I'm saying, well, he can't find it, I can't find it. It's not there for some reason, and maybe this is where this can be pushed back to the VA or something. That's for the PFAS, but it isn't only PFAS. It's also the airplane mechanic that had all the other stuff.
So I think to bring it back to this study, where it could help is it will be, it's about a 50-year look, and we're looking at the cancer mortality, and we can look at AFSC. So if any of those career fields talked about, CE or motor vehicles or firemen, we can see that if there's a higher mortality rate.
Is the only chemical you're looking at the chemical that was in the foam from the fire department in these studies, or is that any contaminants that were used on the flight line at that time? Because we use 7808, trichloroethane, ethylene, or whatever, all the time, wash our hands, clean our tools, whatever.
So the study
like you say, wash them that stuff.
This is not looking at any chemical whatsoever. The exposure of interest is being stationed at Pease Air Force Base.
Any chemical.
It has nothing to do with the chemical, it's just being on Pease Air Force Base. So is there something about Pease Air Force Base that would cause a higher cancer mortality? That's the question we're trying to answer. And so it's divorced of chemicals. That was one of the major concerns, I believe, in the initial listening session, is it's not just about PFAS, PFOA, but what about everything that occurred on the base? And in order to answer that question, you have to dive back and find out, well, what is the question that we can answer? And that question is, if you're stationed here, and we have the ability to get the data for mortality from cancer.
So when we take a blood test, would that show in the blood test that you were exposed to whatever chemical? Are you just looking at foam, or the PFAS you're talking about? Is that caused only by the foam chemical right now, and the other ones? Will anything show that because of what we used at Pease for years and years and years, we caused those cancers?
The blood test, we are not taking a blood test at all. Ours is purely looking at cancer mortality rates. Devoid of any chemical, devoid of any laboratory tests, okay?
But
other tests that are going on to help the Pease community and to try and figure out and to study and figure out PFAS, PFOA, and what does it mean, and why is it a toxin of emerging concern, and what is the concern. Those are the 4 or 5 other studies that are going on. And we talked earlier about the puzzle, right? And truly, all of this is a big puzzle. And each one of these studies is trying to answer a little piece of that puzzle. And hopefully, each one, like I said, might drive more questions, might drive more puzzle pieces, right? But over time, and like you saw in the Lejeune study, it took a lot of time to build the story and to build the information to figure out if there was an issue. So we'll have an answer to the puzzle with our study. ATSCR will have other answers or come to some conclusions as well. And ultimately, the goal is to take all that information and figure out how best to care for and how best to look out for the health of this community, of the airmen.
First of all, there's a class action lawsuit that is occurring nationally with regard to PFAS and PFOS. It's being done by Natalie Skolnick. You might want to take a look at their page. They want people to be a part of this study if they have a valid claim. The other thing is just to give people an idea of the number of substances that are considered to be hazardous that are related to Pease Air Force Base. If you look up Pease hazardous profile, you find a 45-page list of substances, okay, that are considered to be hazardous, each one having its own particular perspective, okay? The most important thing, of course, is those chemicals, they separated out the chemicals so that you can determine whether those chemicals are found in groundwater. And of course, groundwater is something that everybody at Pease is dependent upon. So I just point that out. First of all, Napa was stolen, and the other thing is the profile of hazardous substances at Pease Air Force Base. And that had to be done for, I think it was the EPA. Very interesting to look at. Boring, but just the mere magnitude of chemicals that were not properly disposed of at Pease, were not properly disposed of until 1991. One other fact I should point out, maybe this will help to give people a greater understanding of this. You could have been exposed to PFAS 30 years ago, and PFAS has a certain half-life. Over that period of time, the PFAS deteriorates, even though they call it the forever chemical, it deteriorates. But the effects of that PFAS can stay in your body. Okay, so the fact that they're limiting it in terms of age groups puts some, how valid is that? Well, I don't know. I'm not an epidemiologist, but as I read through this stuff, these are the questions that come to my mind.
Plus PFAS is in our pans, is
Right.
in our the shirts that are non-iron.
Right.
So that's why the presumptive piece, and doctors are concerned about sending in a presumptive letter for a claim, or to get your name into that base. They come back and say, have you ever used the non-stick pants? Do you wear shirts that have non-wrinkle in it? So yes, it is the forever chemical, but the VA is going to push back on some of that as well. Because yes, it is. We know the food station here. We know about the home. We know about the heat well. But the other burp on that is the pants, the shirts, the other materials that we use every day that have PFAS in it. Sadly, that's not how we want to focus on it, because we're looking more about the people that have cancer or die of cancer because of exposures they didn't know. But that is the other piece.
I think, kind of push it back towards PFAS again, and I know that's been a big subject, but I think what's good here, especially starting this particular study for us, is that we're pretty much finding if there's a high mortality for cancer, because a lot of us have been pushing that we work around so many chemicals beyond the PFAS that we have no idea what could be causing these higher rates of cancer that we believe. And so this takes away, like the gentleman was saying, 45 pages, who knows, possibly. But if you find out that there's a high rate of cancer, then you can work backwards to see maybe what's the common denominator per se, compared to just focusing on PFAS in my opinion, because that's everywhere, but with us, we have PFAS plus the whole cocktail that is known as Pease, Air Force Base, and National Aerospace, and that makes this study a little more valid compared to just one specific chemical you're thinking of.
Any more questions? Again, our experts are going to get to work. We probably won't hear from them for another year on the backside, but now's your chance. All right, with that, I want to thank you for conducting the study. We're all counting on you to get a good read, and however it goes, it goes. But